smart. That beautiful brain has so much information in it, and every time we hear her on a seminar and in person when we're lucky, we thank the lucky stars that we have someone like this that is our product formulator and scientist. Her background is astounding, and I believe, Temple, you wanted to cover that background at this point, and I welcome you, Christina.
Yes, Dr. Christina Cook. She comes to us with her PhD, her master's in science from Harvard, sits on 12 different medical boards, and does an awful lot for our company. And I'm not going to stall any longer. I'm going to let her tell you a little bit more about why she's here and where she's come from, and invite Dr. Christina Cook to the front.
Thank you, and thank you for allowing me to be here. I love Canada. I worked here a lot when I worked for Pfizer and Biogen Idec and Alexion, and those are just biotech pharma companies. I also ran companies for a while as a CEO. They were in healthcare, and they were all based on doing patient registries and research to produce pathways that would produce the best way to treat patients per a diagnosis. So I worked with Dr. Green, who at the time was over Medicaid and Medicare and CMS, which was in the United States, or is in the United States, our main insurance company that basically guides us on how we will pay for things and what's approved, as well as works with the FDA and NIH. I have worked for NIH as a research director. My dedication really has been research and science in various areas, from oncology, hematology, cardiology, immunology, dermatology, spine, different areas. I just focused on going into different areas of specialties to learn about diseases where they could not find a solution. I helped develop molecules or drugs at the beginning that would do that. But then my life was changed. I got cancer at the age of about 24 and ended up losing a child and then having a brain tumor and a spinal tumor. So I relate a lot to Temple and to Jana and to women. I ended up having 4 children. My life became those children. I think that whether we stay home or whether we work, we all love our children. And men love their children. They love their mothers, they love their sisters. Like, we're all in this together, we're all connected. But through that, for me, developing something at a young age that I thought I was going to die, I really leaned on the fact that God had given me the mind and a brain that at the time I had a photographic memory and I could speed read. And so, I've always said to people, I could probably handle anything except for losing my mind. It was what mattered the most to me, because I used it to provide solutions and to help people. And so when this happened with a child, and when this happened to me, I really reevaluated my life. It humbled me, and it made me realize how connected I was to everyone in the world, and how much we're all alike. We all have weaknesses, we all get sick, we all die. And I wanted to figure out how, while I was on this earth, I could help people more, and how I could help my family more. So really, the journey I've been on has been one that has been selfish in a way, because I want to help my friends and family. And the people that I know become my friends. But through this path, I really am open. When I meet people, I love them. It's not fake, it's sincere, because I think having almost died at a young age, it caused me to really know what was important. So I get very excited, like when I see people that I've seen, and I tell people this, I recognize faces right away because people matter to me. I'm very happy to be with both of you, because you're such good people and kind people, and you are on the same mission I'm on, to help people. And there's 2 paths. I always tell people, you choose a good path or a bad path. There's no such thing as not making a decision. You make a decision every day. So my decision when I became that age was, I'm going to use the mind that God gave me, and any gift God gave me, to really help people. I was always different, and I think most people that are dedicated to wellness and nutrition and to searching outside of a box of what people tell you to do are different. And sometimes being different is lonely. because you don't always feel like you're connected to everyone else, because a typical patient goes to a doctor, they get diagnosed, and then they do what the doctor says. Doctors go to school for 4 years, and then they go to school more, for anywhere from 2 to 6 years usually, to be specialists and do different things. I've stayed in school for 17 years to make sure I can understand everything and help people. I have 2 doctorate degrees. I have a master's and a postdoc from graduate school at Harvard in bioscience engineering and at the medical school there. And I continue to stay in school, so right now I'm in nanobiotechnology and I still teach. Now, the last time I taught was at Johns Hopkins. I taught classes, and the only reason I'm telling you that is because I find it challenging, and I find it also obnoxious when people tell me I don't know what I'm doing. I don't know everything. There's not a doctor in the world that knows everything, but I work really hard to try to bring solutions to people so they do have alternatives. It does not mean that traditional medicine is not good. It means that you need to know your options and you need to be confident. So before I get into Rain and Soul and what it does and why I love it and why I'm here and what we're developing, I want to share with you guys what really happens when you're a doctor. When you go to school, they challenge you. They basically tell you you do not know what you're doing, and they do that so that you can feel you can basically know when a patient comes in that you can question yourself, right? But along that path, as doctors and scientists and researchers, you can become arrogant. You can almost think you're a god. A lot of doctors don't do that, but some of them do. And it's like a mechanic, and I never realized that till I was actually in school. When a mechanic goes to learn to fix a car, they go to school. When a beautician learns to do hair or makeup, she goes to school. It's not any different as doctors. You go to school, you sit and you listen, you write things down, and you take a test. But how many people have known a hairdresser that goes to school and learns to do hair and makeup, but yet there's someone else that went to the same school that is astoundingly better at doing hair and makeup? Or as a mechanic, let's say you take your car to a mechanic, one mechanic can't fix it, you take it to the second mechanic and they do fix it, or they tell you something completely different, right? It's the same thing. Doctors are not gods. They have an opinion, they study something, and they give you what they know. And they do their best. Most people that go into medicine really want to do what's right for people, that's why they're there. But they only know what they're exposed to, and then they see patients and they're exposed to patients all day, and it's time consuming. I can tell you guys, when I saw patients, I saw sometimes 40 to 60 patients a day. It was very exhausting. I didn't have time to think. I would read the chart as quickly as I could, and if I told you guys I never made a mistake, I'd be lying. And I want to share a flaw to emphasize my point. Not a flaw about another doctor, but a flaw about me. My son had 104 temperature one day, and I was overseeing 17 psychologists and doctors as the supervisor in intakes in a community mental health center. We had one person after another came in, and I would see the hardest cases. I was the supervisor. I was very young. Same child that the other twin had died. Duquesne, I think my oldest son was 1 at the time. He's now 22, almost 23. I saw a couple, and I knew they were struggling. They talked about all the issues that were going on. They had a baby. I asked about homicide. I asked about suicide. I asked what was going on. Long story short, in my opinion, I got a phone call in the middle from the nanny that said that my son was going to the hospital. He was sick. I wrote up the notes as quick as I could. I was worried. I had a gut feeling something wasn't right. I asked the appropriate questions and then handed it over to someone else. That night, that couple killed their child. I was the doctor on call. I saw that on the news the next morning while I was holding my baby, Duquesne, and trying to take care of him. He was very sick. That wasn't the only mistake I've made. I'm letting you know because I'm not perfect. Doctors are not perfect. Did I do anything intentionally wrong? No. Did I do everything that day the best I could? Yes. Did I fail? Yes. I still think about that. Because that baby did not know me, and I did not know that baby. I thought that they were okay going home. I could have put them in a psych ward. They were meth addicts. The father killed the baby, and the mother was there. So I'm telling you this not because, again, I tried to do something wrong. I'm telling you because doctors are human. And I'm telling you because you guys are in charge of your life. And if there's any gift I can pass on to people, that will be the gift. To be able to be educated about things around you, to trust yourself, and to trust your bodies. I say this all the time, and if you guys ever heard me speak, you've probably heard me say this. I love traveling, I love people, because every single city, every single country is different, and every single person you will meet in your life is a gift. That's a person, they're their own city. So when that person gets sick, what happens to them is not a cookie cutter book you read on how to fix someone or something. There's not a manual on you that every single doctor you walk into has exposed to. You have the best manual. Doesn't mean you shouldn't listen to a doctor. They're absolutely experts. But it does mean you need to be educated on what's going on in your body and how you can do the best you can do to help yourselves. So that if a doctor isn't there, or if a doctor just happens to not have the right opinion or doesn't give you all the information, you've been educated. Do not look at life as a chance. Look at like something happened and it didn't mean anything. No, everything's connected. Energetically, I can tell you as a nanobiotechnologist, everything is connected. Energy feeds off energy. When I work in a lab, when I work with cancer, when I do research, these cells in your body talk, and they're all different. That's why when one person takes a product, they may notice a huge difference right away. When another person takes a product, they may not notice anything. They may notice something 6 months later. But what you have to do is become your own doctor. Become your own expert on your body so you know what you're putting in your body, what's happening. That's why I'm really big into research. I'm really big into when you look at what happens under a microscope, what do you see? And then I'm also interested in when you ask people what's happening and what do you feel, what is that like? And I report on that. So I'm one of the scientists that's registered with the FDA as a principal investigator to look at what's called patient registries. And what that means is I look at per a diagnosis again, what happens with people when they take certain products. And I'm doing that at Rain with the products that we have. Is that time consuming? Yes. Is it a lot? Yes, and let me explain why. If you ask me, tell me, Christina, about your life and what you've gone through, that's not a 2-second conversation. If I ask you, it's not either. And if I ask you, it isn't. Everyone has a different life. So to really do a patient registry, you have to understand what's going on in people's lives. And then you have to what's called stratify it and report on it. So today, I want to talk about what the products at Rain are known to do. And then I want to talk about what possibly they are doing in your bodies, remembering that every single body is different. When you think of your body and you think of the cells in your body, as a scientist, one of my professors told me, and I love this, Christina, the cells in your body are talking. And this was when I was working on HIV, I was working on a retrovirus at Bristol Myers Squibb. I was also in school. So we were trying to figure out how do we go in and communicate with the virus that keeps changing because HIV is so smart, it changes constantly. How do we go in and get it to stop communicating and stop changing? Well, we wanted to be smarter, but we weren't always smarter. So what we had to do is start thinking like cells, which the cells in your body are like people. When you think of your body, and this is a city, the cells are people and they talk. Energetically, they communicate. That's why cancer grows. That's why multiple sclerosis grows. I want to tell you something about cancer because I've had it so many times, and I've lost a child, and I also had another child with cancer. Cancer is typically from an environmental stressor that occurs that causes an epigenetic or causes inflammation that then causes the disease to grow and communicate. If there was just one cancer cell, it wouldn't matter. Here's the problem. That cell talks to the other cells around it, and a tumor grows because that cell literally communicates with the cells around it. You guys are stupid. You need to look like me. I'm strong, I'm great. But it's deceptive, right? It's not strong, it's not great. But what people don't realize about diseases is that disease wants to live. They want to take over the body. You have to think in your mind energetically and communicate with the cells and put the ingredients into your body so they don't grow and they don't communicate. And another thing about cancer and other autoimmune diseases is this: they hide. They're so smart. So when cancer is exposed to chemotherapy and radiation and you get basically you're doing great, you can go home. What they may or may not tell you is that cancer's still in there, imprinted in the body. Remember, positive energy impacts positive energy. Negative energy impacts negative energy. And anyone that tells you that's not true is incorrect. I see it in the lab all the time with the cells. I watch them communicate. So if a cell is sick and has cancer, and chemotherapy or radiation or stem cell drugs go in and get rid of it and eradicate it and kill it, it still has communicated with someone all the way across the body its message. And they hide and they come back out later. So what you have to do is understand that, prepare for it, and feed your body with the right nutrients so it can fight that. And to tell you that your own body can't fight that isn't true, because I've done research, and I've done a lot of research when we were going in to give people experimental drugs that I actually was part of the team and worked on, and I was the principal investigator. We would go in, we would do a scan, and the cancer was gone. Why was it gone? We didn't give them a product yet. We didn't give them an $800,000 molecule yet, because we had no answer. It was a miracle, or we don't know. But what we're learning is that the body can learn to fight things. That's why when Lance Armstrong came out with the fact that he had a brain tumor and then it was gone, and he used positive energy and positive thinking, he said many times, and this is true, he doesn't want other people to feel bad because they can't get rid of cancer, because we all do die, and we die of something. But he did use different natural processes and different natural things, as well as positive thinking, to tell himself he was going to get better, and he was able to beat it. So today, I'm not here saying that Rain has products that will get rid of cancer, or Rain has products that will get rid of every illness you have. But what I am saying is that when you take ingredients into your body that are like black cumin seed, black raspberry, Chardonnay grape, and they're manufactured and used in a way that really can communicate with the cells because of how they've been processed, you have great results. That's why you have all these studies coming out of Vanderbilt, and I'm partial to Vanderbilt because I live in Nashville, Tennessee, and both my grandmothers and grandfather went to Vanderbilt, so I'm partial. They've done a ton of studies on the oils. And I'm sure you guys have heard of companies that have oil. Oil, like oregano oil, comes from oregano seed and the plant. Everything starts with a seed. And the seed is one of the most potent parts of the body. That's why a lot of times you guys will read, for example, apricot seed is good for you, but it can also cause damage because of the lectins. Apricot seed is used in certain chemotherapy products. It destroys bad things. If you use too much of it, it can be toxic. However, if you manufacture it in the right way, it's something that's very good for the body. So today, I really want to educate you guys on the seeds that we use and why we use them, and what we're planning to use in the future, and why those are so important. And why, to me, I left pharmaceutical and biotech and left being the CEO of a company to do this, because it was not my plan. And that people have asked me many times. I was introduced to RAIN because I was focusing on detoxing the cells because my father had cancer. He had stage 4 advanced head, neck, and throat cancer. I came up with some patents and some formulas that are used in the environment and with people. And I actually used them. I didn't take any payment for this. I still haven't. I used it for my family, and I had a deal where I could get samples of the product as long as I produced it for my family, my parents, my children, and everyone else that I wanted to give it to. Met RAIN, I met the CEO and the executive team, and they started talking about it. I didn't realize it was an MLM company. So not that I'm against MLM companies, I just didn't know anything about it. If you think about me, I don't know anything about sports either. Really, I don't really. I have 4 kids and I work a lot, so I don't know a lot about a lot of things. That's a misconception about me. People will ask me, do you like wine? Yes, I like wine. Do you like to dance? Yes, I like to dance. Sometimes I forget I like those things because I'm working all the time, but I actually do. And I did not know about MLM because I just didn't know what that was. I know I ask questions and I probably sound ignorant because I still am so focused on the science research side because I have to be. And I've jumped in and I express this with RAIN because I love the company, I love the products to help also on the business side of things, but I don't sell the product only because I want to be able to stand up here and always be honest and never be persuaded because I own the product or I own the company or I make money off sales. That's what other people need to do to get the message out there. My job is to understand the science and research, because remember when I told you guys how many mistakes I've made, and when I told you guys how I don't know a lot, like every day I learn something I don't know. And people will ask me questions and expect me to know everything, and I'll have to say, let me get back to you. Let me look at that. I'm lucky. I have access to Harvard's library and Harvard's lab, and it's a great university. So I can look up things that a lot of people can't get their hands on. And I feel very blessed for that. But I don't know everything, just like and many doctor acts like they do. They don't. Because I was blessed with a photographic memory. I was blessed to be able to speed read. You can hand me a sheet and I can read it in a second and hand it back to you. I'm lucky. I know that. I have 2 children that can do that. It's a blessing. There's other things I'm horrible at. If you ask me to be downstairs on time, that's very rare that I am. If you ask me directions somewhere, there's no way I can find it. And if you try to explain to me how to get there, I can't. Johns Hopkins diagnosed me as an idiot savant. That is not a compliment. At first I thought, that's awesome. I looked it up. I'm like, that's not a compliment. This is an idiot. There's basic facts they determine that I don't understand, that it does not hit me and I will never get it. The great thing is, because I'll never get it, I do understand, kind of, I don't get it, but not completely. My children explain that to me because I still can't work the microwave, still can't work our TVs in our house. So, and that has been for the last 10 years, and they keep showing, Mom, you just hit this. I'm like, I can't do it, and I hand it over. The reason I'm telling you, my focus at this company is the science. So if you ask me a business question or a sales question, you would have to go to Temple or Janet or one of you guys that are selling. I will not know the answer. But going back to the seeds, I really fell in love with the company. They wanted me to do a research project. They wanted to ask me about detox and explaining detox because they plan on getting more into this as a company. And then they wanted to talk to me about other products. At the time, they were making sure that the soul formula was right and core, and they were planning on working on additional formulas. So I came in and I did basically a guest talk. I was in, I think, Vegas, and I was overwhelmed by it. I'm used to talking to doctors on stage and different countries at universities. I'm used to presenting and educating and teaching And so it was a very different experience for me, and I was a little overwhelmed. And during that first year, I hit a point, I remember one day and said, I just can't do this. I can't be in front of people, because sometimes I was in front of 5,000 people in different countries. And I wasn't used to people coming up and talking to me. I was used to people asking questions in a crowd that were doctors or people and answering them or helping patients. So thankfully, everyone stuck with me and liked me anyway. And I got to work with this amazing company. And I've been able to work with the seeds, and I've seen, I have to tell you, more results with this company than I ever was able to see at the other companies I've worked with in pharmaceutical and biotech. I'm not allowed to talk about all of them on stage. I am the chairman of a seed society that we are rolling out, where we're gathering research, and I can talk more about the results that I find when I talk about the seed society. But because of the FTC and the FDA and regulations in Canada, the United States, and Europe, I can't make any claims. I can talk about research results and research studies and what we see in a lab, but I can't ever say, for example, I know this product cures multiple sclerosis, right? Even though, I don't know if you guys know this, when you have a drug that you take, or a chemotherapy or a radiation, the laws around that are that you need to have a 40% efficacy. Do you understand what placebo is? So when I work on a product, I can get it approved and roll it out, and it does help people. So if it helps 40 to 50% of the people and you've got cancer, that's miraculous. There's some products that might only help 20%, but because there's not another solution, that's what doctors have to offer. And it's not that doctors or governments or societies are trying to do the right or wrong thing. They're trying to offer everything they can, right? So when I go into a country like Malaysia or Vietnam or Russia, I can go on and on because I've been to a lot of countries, and I see the case studies and they hand them to me, and I see things like Temple, and I see what has happened. I can't do a lot about it as the chief scientist at RAIN. I can as the chairman of ISNS, and I can answer questions that pertain to particular seeds and particular products. And soon we will have survey results, because we're gathering them finally, so that we can report on what these actual products do. And as the principal investigator of the study, I can report on everything to you all. But we do have some things to discuss today that as it pertains to research. And I do want to tell you guys why these products are so phenomenal and why I am here. So going on to the next slide, when I walked in and I sat down with the executive team, I did not quite understand why seeds, and were so phenomenal on what they were doing. I did understand, though, that a lot of the stem cells I had worked on in biotech came from a mixture of human stem cells and plant stem cells. So I did understand how to work with them in the lab. I understood that when we made biotech products, which again cost anywhere from $80,000 usually to $400,000 to $800,000 a patient, that we would produce targeted therapies that would go in, communicate with the cells, and make them healthy, or cause sick cells to die, apoptosis, right? That's what we did. And I loved doing that. I also was one of the scientists that worked on cloning. I loved doing that. So I understood certain parts of the seed, but since I've been here, I've learned even more. Because if you really look at my background, what I do is I go in, learn about a disease state, and what happens in the body, figure out a solution. And what I used to do is produce this solution. And that's what I'm doing again, but on the nutraceutical side. When I came to RAIN, they already had some solutions that I ended up loving. The more I started looking into the black cumin seed and the black cumin seed oil, which was the foundation of this company, the more I started seeing all the patents around black cumin seed and black cumin seed oil. I'm a patent person, because here's what I do as a scientist. I go in on everything about a disease, everything about every drug a product available, and then I attempt to make something better. That's what I do. Not because I want to make something better, because I need to provide another solution to people. And again, let's go back to selfishly. Selfishly for my children, my parents, my family, my friends. So, when I started looking at Soul, which was the main product that they had, which had been tested and used in the Johns Hopkins area of the United States, around Maryland and Johns Hopkins, and was used for children that were on chemotherapy. And I even saw some of the studies where they used it, where they were using it in the IV, and then I saw in Malaysia and Vietnam and all these other countries where they were doing the same thing and actually pouring the product on things that had parasites and viruses and bacteria and tumors, and they had these phenomenal results. It obviously caught my attention. And then when I saw thousands of research articles and patents around the same thing, and then I looked historically about how this product had been used to cure illnesses all over the world throughout history, I was sold. I think the final thing that sold me, though, was here I am detoxing on my own products that, again, I don't sell. I don't, I just have my family on different things. I needed a supplement. If you've had cancer or an autoimmune disease, just so you guys know, you've got to detox the cell, make it clean. You got to break apart the toxins that are inside and get them out and have them leave the system. And then what you have to do is supplement the body. So when I saw Soul, and I knew that this is a product that has black cumin seed that's known throughout history to be able to be treated in third world countries where it was used instead of chemotherapy for cancer, and they had great results, or in support of chemotherapy in the research through the seed, it had my attention. Knowing that when I was pregnant, I had a child. There was two children. One of the children developed into cancerous cells instead of a baby, which was a very hard concept for me. I was young. The other child was born healthy. He had a 1% chance of being born healthy, but he was. Knowing that when that happened, the doctors told me, you're always going to have cancer. It metastasized throughout your body, so you're going to live with it. And we don't know how long you're going to live, and here I am, I'm 50 years old. So I was 24, right? And so here I am. Of course this is catching my attention. And then the other side of my brain, the one that's in traditional healthcare, who has studied her whole life to make drugs and molecules in front of doctors, was arrogant. Literally. I mean, I try to admit when I'm arrogant and wrong. I just had to admit that to my children tonight, something I did wrong. I said, it's an exercise I always do with myself. I'm wrong, how do I fix this? So I said to myself, this is wrong. Do I think I'm better than to work on a natural product because I get more attention if I work on a molecule or clone something? And I realized through the data and the research and the cell-based studies, as well as what I was seeing, I decided to stay at Ryan. It was not my intention. I still kept the studies. If you go to clinicaltrials.gov, you'll see my studies. I still have a lot of studies with the FDA, and I still consult and help people on drugs and other products. But I became completely convinced through the data how important this was and how much my family needed it, and how other people needed it, and how they needed similar products that we could just keep making better and better so that we could help people. So that when a doctor says you have stage 4 advanced head, neck, and throat terminal cancer, which was my dad, and they say it's in all your lymph nodes now, I can say to my dad, take this, even though they say that you have 3 months to live, which is what happened. My dad, I think he detoxed, and now he's been on this for about 2.5 years. And they haven't been able to find it anywhere. So, I want to be able to bring those solutions. Again, I wish I could say every single person that took this product would miraculously get better overnight. But again,
Everyone's body is different. What you gotta do is give the body what you know the body needs to have a fighting chance to be okay. And then you've got to love your body. I said this to Temple and to Janet. I'm always amazed. People will spend thousands of dollars on a house payment, but this is your house. Like, I don't know if everyone realizes this. You go home and you need a place to sleep. You take this everywhere. Like, this is what I'm taking everywhere I go. My skin, I'm taking this wherever I go. I can't leave it. Maybe there's days I want to, but I can't, right? So you gotta spend money and time and energy and love yourself to do that for yourself. I actually did not know what the products cost until tonight. Temple told me, and I go, oh my goodness, I didn't know that. I never knew. I know that the molecules I worked on, they cost $400,000 to $800,000. I knew the psoriasis stem cell I worked on cost $80,000 a patient, right, per year. I know those because I was also one of the scientists that would go to the payer groups and the government and talk about why we needed these products, right? But I never knew this about the products. But it makes sense to me because we sourced these seeds from the best places in the world. One of the reasons MLMs don't attract doctors or scientists like me is because they'll make a product and they'll change it. Or they won't use the best ingredients. And see, when you work for a Pfizer or a Biogen, your top 5 pharmaceutical biotech companies in the world, they can't do that. The FDA is regulating it, every government's regulating them. We know what we produce is out there. And again, if we have a 40% or 50% efficacy or 20%, we know that data. We have hundreds of millions of dollars. I had 21 people that worked with me on a project versus when I do it here, it's me. So it costs money to make this product. And the manufacturer that manufactures this product, I actually have consulted with that manufacturer on numerous products. So he has brought me in to look at solutions to other products and how do they fix them. And I can tell you, and this is what I told them, these products have the strongest ingredient and they are able to really help people in all these countries because of the potent oils and seeds and powders in them and how we manufacture them, which takes time and takes effort. You see, vitamin E, who's ever heard of retin A? Retin A is used for psoriasis, for dermatitis, for acne, for aging. I worked on that, and it's a vitamin, right? So when someone says vitamin C is just vitamin C, I'm like, no, it isn't. Vitamin E is just vitamin E, I'm like, no, it isn't. There's so many different ways to work on a product to make it something different. I know a lot of companies would like you guys to think that, but it's not true. It's like saying, I worked on a molecule where we used human DNA and mouse DNA to fix a disease called paroxysmal nocturnal hemoglobinuria and AHUS, which are basically rare forms of blood cancer that cause people to die pretty soon. We were able to work on that, and we mixed it with a basically stem cell of a seed of corn, right? I know that sounds odd, but that's what we did. So there's different ways to manufacture and produce seeds, and what Rain has done is they've taken for their base product the black cumin seed and the black cumin seed oil, the black raspberry, and also the white Chardonnay grape and the D-ribose to make a formula that has been very effective with lots of people throughout the world at supporting their body. And after we have a break, and I can talk a little just for 5 minutes later about ISNS, and you can ask me questions, I can get into more of the research that goes particularly around it if you guys have specific questions. But when we went in and we did what was called third-party testing, I want to explain what that is. You go into a lab, you send them the ingredients or the product, they test it against the cells under a microscope. Remember, that's my background. So It's really what I understand. And they look to see how that cell reacts to those ingredients and what happens. And when they did it, and we used Brunswick, which is one of the best, if not the best lab to send it to. So when they did it, they really found cellular anti-inflammatory assays were significant. There was a 33% reduction, which is very significant. I can tell you that I've worked on numerous products with other companies that were not nutraceutical products where we weren't able to find results like this. And basically, when you look at this, your inflammation in the body is caused by, I told you guys, environmental stressors. Heavy metals, bacteria, pathogens, stress, drugs, bad food. I say this when I speak on stage, between 1 out of every 4 or 1 out of every 7 patients that die are from something related to a drug they took as a drug overdose, or their body couldn't handle the drug. That's why when people are treated for various diseases, a lot of times they'll die from the treatment rather than the disease. So what's remarkable about this is they looked at the control group, which was without SOL, and they looked at SOL, and that's where they saw the 33% reduction of cellular inflammation, which again, that's huge. And what that means is the body is able to fight those things. So remember when I talked about the cells or people in your body and they're communicating? If you can cut the inflammation off, you're cutting the communication off. If I have cancer, which I have and do, if I know that, what do I want to happen? I do not want it to come back out of hiding. I do not want it to communicate. I want it to stop. I want to take the cell towers down. Think of your cells in your body having phones. You're calling each other. Take the cell tower down. You're knocking out 33% of them. That gives your body a chance not to communicate if you have a brain tumor like me, not to communicate with the lymph nodes to say you need to grow here now. That's what you want to do, and you want to tell yourself that. Look what I'm taking today. This is what's happening, and that's why it's so important for you guys to understand what's going on. And then 62% increase in the stimulation of the anti-aging properties. Of course, I care about that. Do I care what I look like? We all care what we look like. Is it the most important thing in my life? No. I told you guys what's important to me. And anyone that really knows me knows that about me. It's also important to me that I be happy and to have fun and for my mind to be able to work, right? Do you know that the more money you have and the smarter you are, the least likely you are to be happy? That's true. My first PhD was in psychology, counseling, and neurology. Why would someone go into psychology? Most people go into psychology because they're not always completely happy. I've never sat around and thought I'm depressed. But I've been unhappy and lonely many days, and I understand the statistics. So what do I want? Do I want to live a life where the cancer's growing, or do I want to live a life where it's not communicating? Do I want to live a life where I can look better and I can fight off aging and my mind can work better and the hormones in my mind and my body can work better? Yes. So one thing people don't understand about aging is that the activators that actually cause the aging can also cause depression and anxiety. That's why, a lot of times you have elderly people that are depressed. That's why, usually when people are younger, they don't feel depression yet. Some people do, but it's not as prevalent because their body is working appropriately, the hormones are working, the transmitters are working, the communication is positive. So when they went into the lab, what they found is the protein that's believed to be the most important in longevity and the reduction of age had an increase of 66% stimulation, which that same protein, just so you guys know, stimulates metabolism and mood and neurotransmission. Another great positive thing. This is facts. These are facts. These are not a question mark or a feeling. These are the facts. Then as far as the antioxidant assays, we found 2.5 times the average free radical reduction. And it was in all the nutraceutical products ever tested at the lab. They had never seen this. They were really blown away by it. And what that means, again, is that with the human cell, as far as damage and the oxygen radicals, they were able to see that this was able to protect those cells. That's what that really means. And to fight off the things that were harmful to the cells. Again, think of yourselves as people that are being attacked by things in the environment, in your life, and that causes diseases. That causes depression. That causes aging. They were able to see in the cells that it caused that type of reduction. That doesn't sound like a huge reduction, but it is. That's very rare to find. And then when you look, and I want to say this, we don't have to go back to this slide. I want to make sure I say this though. It stimulated basically the oxidation and the oxygen basically to those cells is what it was doing. So it was giving them basically life, right? So that they could deal with things. And then just to talk about how we are a non-GMO, you know, a lot of people ask me, Christina, do you eat gluten? Well, I'd rather not, but what's most important to me is that I'm not exposed to GMOs. Do you guys know about the lawsuits that are happening right now in the United States when it comes to GMOs? So, one of my best friends right now is the president actually of the Seed Society. I lived with her for 7 years. She's one of the top executives in New York, around the world. She's taking a break, so she's doing this because she wants to get back. And her husband actually is one of the top marketing branding people in the world. He worked with the company that's being sued, and I don't want to mention their name on stage, basically for fertilizer. $250 million. Because one person was able to document the fertilizer caused the cancer, because really it was GMO. I don't know if you guys realize this. And he says he still feels guilty to this day for marketing for that company. Because now everyone's coming out and the tests in the lab are showing absolutely that caused the cancer. I'm a nanobiotechnologist, so what do? I modify things. I genetically alter things. If you genetically alter something so you can get what's a bigger result economically, you're hurting people, and that's what we did in the United States. We genetically altered different fruits and vegetables and fertilizers to kill certain things, and in the meantime, what we did is we put things in our body that would kill us and would cause inflammation to spread. And I don't think anyone tried to do it on purpose, but that's what's happened. So it's very important when someone asks me, what do you like to eat? I don't like GMOs. Do I eat them sometimes? Yes. If you guys think I have a perfect diet, no. That's why I detox, that's why I take these products, because here's how I think of my life. I know I'm getting on a plane, I am exposed to radicals in the air, I am getting hurt on that plane, and I know it. I know the statistics around what's going on in the airstreams and how much I'm exposed to for radiation. It's not good. That's why the average, I hate to say this because I just remember what your husband does, but the average life expectancy with pilots and issues that go on.
He's eating the rain.
Yeah, that's why you take rain. Because I say this to people, you're gonna be exposed to negative things. Our lives aren't perfect. We're not perfect, we make mistakes. So you put the things in your body that you know are going to help protect you. It's like, so your body's yours. When I raise my kids, I know they're gonna make mistakes. I know they're gonna go out there. I just dealt with one of my sons today, he's 19. He called me crying. He was saying that he thinks I think I'm perfect, and I was explaining to him the many failures that I've had that I had not explained until today. And he said, why didn't you just tell me that before? I thought you hadn't made mistakes. I said, no, I've made many. But I sent him out there knowing he's going to make mistakes, right? But preparing him for when he does, how he's going to deal with them. You got to prepare your body the same way. Love your body. Love the cells and the people in that body and protect it. And that's what you're doing when you're making sure that you have a non-GMO formula, and all our formulas are non-GMO at Rain. And I can tell you a lot of companies are not like that because it can be very expensive to do that. And when you claim that, it's different when you claim something's organic. Non-GMO is a different story. When you say organic, and I tell people this all the time too, if you eat a fish out of a sewage and you say this fish is organic, I don't care. If you eat vegetables and fruit and seeds out of an organic field, but it had fertilizer that was GMO and that was toxic, that's not good, right? So it's really, really important. I'm gonna move on to my favorite product, Core. Why is that my favorite product? You guys heard me talk about detox and cleansing the cell. Core is one of those products that goes in and cleanses the body. It's made of ingredients that really get to the core of everything that's going on. When I had the brain tumor and I was diagnosed, they wanted to do a bunch of chemotherapy and radiation. And I wasn't smart enough at the time to understand whether they should or shouldn't. I just had a gut feeling it wasn't right. I had not gone through all this education. I had a master's degree and I was working on my PhD. So I started looking up research, because I was a researcher at that time. I was always looking for answers. I started looking up what other countries were doing to treat cancer and brain tumors. And I found a lot of stuff on spirulina. There was conflicting results. Here's how I look at conflicting results. When I do lit searches, I either go to a library like a Mayo Clinic or Cleveland or Harvard or one of the clinics I have exposure to in their library, or I go to NIH or PubMed or some kind of site that isn't one of your academic sites. And then I weigh the pros and cons, because the way we deal with things as doctors and scientists is we debate, we argue. So if I say, you're wearing black, you might say, no, I'm wearing gray and white, right? We're gonna disagree, because that's what we do to learn. So I found conflicting information on spirulina, but when I weighed it all and I looked at all of it and I sped read and looked through as many as I could, I saw phenomenal results. I saw in vitro and in vivo, and all that means, those words, in vitro and vivo, are in the lab, outside of the lab. So when you guys hear that, that's all that means. And when you say animal studies, that means they did studies with animals and then human studies. So it's just different words we use. I think we use them to complicate things. You use words and don't realize, you say it. So it's not a big deal, but that's what I did. I looked at everything I could find, and basically I found that some of the top ingredients that were used were basically green products. And I looked at it, and I looked at the antioxidants and what it showed, and the cleansing effect, and the anti-cancerogenic effect of things like kale and spirulina and spinach and grapeseed even is another one that does that, even though it is in one of our other products for the soul. But I saw these, so what I did was I started drinking every day instead of coffee, and I do drink coffee again, but during this period I drank spirulina shakes that I mixed with other greens, breakfast, lunch, dinner. It tasted horrible. I did not put any sweetener in it. I wanted to live for my child, and I didn't care what it tasted like. I got very skinny. I looked great. I didn't look great, that sounded bad. I thought I looked good because I lost weight, but I was sick, so I didn't really look great. I looked sick. But what I saw with that was something that I researched a lot about the PACs, which are your plant-based compounds, and what they do. So, you guys, this is when I was 24, 25 years old. So what is the coincidence of me walking into an office I don't think I'm gonna stay in, and they have basically a product that I would have made, that I did make? Because if you look at the core ingredients that are in core, the basic ingredients, you will see different things like the aloe vera, spirulina, chlorophyll, dandelion, all the things I used in those shakes. And I was blown away by it. It's one of those things where you again realize that there is a connection to something much bigger than you, and you do understand how important it is that you recognize it and admit it, and then are humbled by it, and then that's what happened. And so with core, when we went in and we looked at it, We found out that it had a 1.67 times greater than the USDA average for basically the fruits and vegetables, which is really high. So when you take this, let's say you go into a day and you're not worried about cancer, you're not worried about autoimmune diseases with the skin or with the body. You know, when you take core, you're providing your body with all the vitamins and minerals and the plant-based vegetables and proteins that you need. So that's what was really amazing to me. But again, speaking selfishly, because I want to go back to this in case anyone here has had an autoimmune disease, I wanted that product, and if I would have left Rain, I would have taken that product forever. Because I don't have time with my schedule. I usually sleep 4 to 5 hours a night, sometimes less. And I have kids and I have work, and I don't have time with my schedule to make those shakes that I had when I had one child. And candidly, I can't make a shake as cheap as I can take core. So people ask me, are there preservatives in your products? Are there any sugar? We do add certain stevia and certain things to our products because we have to in order to get a mass public to take the product. We also, I want to explain this to you guys, there's the reality of being a scientist, and then there's what I would want to do. So when I make a product or work to reformulate or make a product better, I send them a list of what I want in that product and what the best thing that everyone can take if they can have the best world they can take. Like in my best world, I get to work, but I get to see my kids all day, every day. That's not the reality. With products, if you ask me, could there be a better product than core to cleanse the body? It does have some detox properties, but it definitely also has cleansing properties. My answer would be not much. I don't really think I could change it much to get it out to the mass public. It's a really good product. It's able to go in and really support the body and produce in the lab the antioxidants, the anti-aging, and the anti-inflammation. It actually, in some aspects in the lab results, and I don't know if they're on these slides or not, but it actually has a higher ability in some areas. I think it's 67% instead of 66%, able to really help with the antioxidants. So, one of, if not, and you guys are really big into the auric, aren't you? Because we're running those tests right now. Have you guys seen them on the new products on auric? I don't know if I'm allowed to talk about them, but that's why I'm getting a little confused because we got them back on a bunch of our other products. So auric is something a lot of the companies use to look at the total antioxidant power. And we were able to see with core, it delivered the antioxidant protection against all 5 of the primary radicals, which is a big deal. And actually we have other products that we've produced since then that are very high in this as well. So it really provided a comprehensive antioxidant protection, and it's not on these slides, but like I said, some of the other results that we saw at Brunswick were the anti-aging and the anti-inflammatory processes, just like Sol. So a lot of people say to me, Christina, here it is, a 67 reduction. I really like Sol, and I do too, but if you are sick and you had any autoimmune disease, this is a product to me that's a must, because you're able to go in and really provide the body with what needs to happen when you're cleansing the body to shut off the communication. Because when you have a 67% reduction of pro-inflammatory properties, that's huge. Again, you're shutting the signals down. And that's a little bit of a different way to say it than we did with the Sol. But again, it really is producing the oxygen that's producing the cells, and it's cutting off the communication with your cells if there is an inflammatory cascade. At any time you have an autoimmune disorder, you have what's called an inflammatory cascade. It's growing, it's talking, it's strong. So to cut off 67% and provide oxygen is huge. That's my interpretation of that data. In sales and with some of the other leaders, they talk about it a little differently. But what I think about is when I'm looking at it under the microscope. So I really think of it again as this, as if you have your own body and you get to make the decision, there's lots of things you are going to eat during the day that are going to cause inflammation. If you eat bread, you're causing inflammation. If you eat carbs, which I love, you're causing inflammation. And if you told me that just don't ever eat them, I would tell you that reality is probably not going to happen. Now, there have been times when cancer comes back when I completely stop. But the ability for this to stop, that communication, even more, whether you're eating something or not eating it, whether you're stressed throughout your day or you're not, is huge. So I want to tell you another story. I told you guys, I think about my children, I've got 4. That oldest son is a rugby player. My kids are athletes. My ex-husband was a professional football player in the United States, so they're athletes. My oldest is one of the top 100 rugby players in collegiate sports in the United States. Who cares, right? In the end, is that going to make my son a better person or a happier person? No. Does that make me love him more? No. But it's something he loves. Again, it makes him happy. So he tore his ACL and meniscus completely. And I don't know how many of you guys understand what happens when you do that, but that's pretty severe. When he did that, he was not a great rugby player. In fact, I could not believe he even made it to the level he made it. He's my least athletic in my opinion, which I don't want to say that on film, but I think he's the least athletic, but he works really hard, he tries really hard. And I always say, you're a fighter, Duquesne, you made it. You had a 1% chance, you made it. And he's a fighter. So when he tore it, the doctor said you're not going to be able to play rugby. He is religious about soul and core. He detoxed, he had, again, the detox, and then he soul, core. He came back the next year. We went to the banquet, and I'm still very close to my ex-husband. We were both sitting there together, and they said we want to announce the MVP player of the SEC, and we want to announce the all-conference SEC team. And the last thing either one of us were thinking was Duquesne, because we're so busy we didn't get to see a lot of sports. They announced my son's name. The only reason I finally got it was my son is they said he is a very spiritual person, he leads people, and he loves people. And I thought, that's gotta be Duquesne, because most rugby players in the United States are not like that. And Duquesne's really religious, and he does a lot with the church. So it was Duquesne. And I said, what in the world? And his coach said, I don't know what you did, but this kid came out of a complete tear for a meniscus and an ACL and was faster and better than we ever saw him. And he joked that it was these products. And of course, I'm sure the coaches thought it was a joke, but you can imagine now a lot of the rugby players take the product because they don't really care what it is. And, I will send them the product to my son. So and the reason I'm bringing that up, Duquesne does not have cancer. Duquesne does not have an autoimmune disease, but I love my son, and I want my kids to have the best chance they can to be whatever they want to be. If they want to be a janitor or whatever they want to be, because there's not a right or wrong answer in life. Whatever you do in your life, if you do it positively, you're impacting as many people as a doctor. I mean, you think about it. So I want my kids to have the best shot they can have, and that's what I want to express to you all. I love the lab results. I love the fact that we have an ongoing commitment at Rain to do more lab results, and we're doing them right now. And I'm going to let people get testimonials, and then later if we have time, I can share a little bit, or they can, about the seed societies and the surveys. And I actually brought examples of the studies to show you all, but I'll leave those with you all. But I do want to tell you that I have had to learn to talk and try to communicate, not just scientifically. And I think I failed for about a year. I'm getting a little bit better at it. But I think what I want to talk about is the science and the research, but I really do want to impress upon you guys that I'm a person just like you guys are, and for me, I do get the ability to work with the top doctors and scientists and researchers, and I feel very blessed because it helps me learn how to do things. But more than anything, I'm a mother, and I'm a daughter and a friend, And my journey here is because I want to help people. And I did have to humble myself a little bit because I do think a lot of us, people make fun of the fact that, well, how can a nutraceutical product really help people? But if I really step back and when I started really being honest with myself, why would I think as a scientist I could produce something in a lab that's not natural, that's so much better than something that's natural, that we used in a way to make sure we processed it so it would be delivered to the body? If you really look at drugs, there's something that we got from nature and then we made it, man-made it. Nutraceutical products are just more natural. They go into the body and they supplement and support the body. But if you can support and supplement the body and then cleanse it while you're doing it, you're able to really support your lives, and not just when you're sick, but just every day. But I do want to emphasize this. Everybody is different. I know I said that earlier. If I'm not sick and I start taking this product, Core is a powerful detox product. So a lot of times, you can be sick and not know it. It's silent. Have you guys ever heard of people that they don't know they're sick and they die? They find out they're sick and 2 weeks later they're dead? Or they have a heart attack and they're 51 years old and they never knew they had a heart problem? That's because your bodies are hiding and silent. Then other bodies have outgoing personalities and they yell, I'm sick, I'm sick, I'm sick. That's my body. When I'm sick, I know I'm sick. And so you've got to support your body, and not just when you're sick, but all the time. These products have a very rare ability to cause people to have an allergic reaction or to get sick. However, every product, including water, can do that. So what you would do if you took this product and you thought maybe it was causing a reaction, you would take smaller amounts. So for me, when I started taking Core, I was sick. I was like, this is not working. What is going on? And then I realized, my body is not used to this. My body is used to not putting these ingredients in because I used to do it when I was sick and I haven't done it in so long. So I gradually took Core. Now if I don't take Core, I notice a huge difference. That took me about 3 to 4 months. It took me about 8 weeks to get used to Core. Then it took me probably 3 to 4 months. I didn't really realize what it was doing for me until I stopped taking it and then got sick and it didn't feel right. But my blood test and my test results are phenomenal since I've been on these products. I get tested constantly because I have had so many different types of cancer. And I just want to express that. Again, it's not a cure-all. We can't make claims, but it's a support system for your body, and we all need that. We don't just need it from each other. I do think we need to support each other, but I think we need it in our bodies. So thank you for the opportunity. I appreciate you guys allowing me to talk, and I will be able to answer questions later if you want.
Based on all the research that was presented, I wanted to tell you a little bit about what happened to me when I started taking Rain. I started with the product because I wanted to remain medication-free. I've been 10 years on a high antioxidant, high anti-inflammatory-like diet. And I started taking the Rain on a regular basis to maintain that. So most of it was about keeping myself off of, I was on Singular, Baclofor, Palmocort, Ventolin, and Chlorotriple on 5 different medications. I had an 85-year-old bone density, and when I fell, I break. My bone density hasn't gotten worse, but it hasn't moved. So hopefully when I become 85, I'll catch up to my bones. But what happened one day, I was standing in the hockey arena, as I do 6 days a week. And I was standing there, and the whole left side of my face went numb, my left arm went numb, my fingers went tingly. And I turned to the kindergarten teacher standing beside me, and I said, just to let you know, there's my 3-year-old. My 8-year-old's on the rink with your child, and I feel like I'm having a stroke. This is what's happening. So should I fall down, please call the EMS. So I sat down very awkwardly, and then the next day, it happened again at lunch. And my girlfriend said, my goodness, like you gotta go do something about it. And I said, yeah, well, it seems to go away. But the whole left side of my face went numb, and my tongue and everything. And so then it happened again the next morning. Now each time, I gotta tell you, I was opening my mouth filling with popcorn at the university, and I was opening my mouth filling with salad, and I thought, well, maybe I'm just pinching a nerve in my face. But then the third time it happened, I just took a sip of juice. So I called a friend of mine who's an ER doctor, and thank goodness, because that's the best way to get into the ER. There's no waiting. My name was already on the board, and a CT was already ordered. So I went in and I got a CT scan. They said it looked like I had a massive stroke. I'm like, what? So I'm making arrangements to get my son off to his hockey game. And make a really long story short, I basically found out the next morning when I came back. I refused to stay over. Not really big on hospitals. And so I went back the next day for my MRI. It turns out I had a brain tumor. And my brain tumor was right in the middle of my forehead, right over top of my olfactory nerve in the forehead. There it is there, the white tumor right between my eyes. And it was something that needed to get removed. I had immediate attention. I had 15 different doctor's appointments and was, looked at my whole body. We did scans. It was either cancerous or it was the kind of tumor that came back. We didn't really know. But what my schedule for surgery was May 8th. And we decided at that point we weren't going to cut my whole face off. We were going to actually go through my nose, which I thought sounded better until they told me they were going to break it in 3 spots and they'd have to fix my deviated septum first. But they did that, and basically I went and I said, well, I read somewhere, one of the studies, I read that somebody doubled up on their rain product. So I'm going to try it. I'm going to take 2 Sol and I'm going to take 2 Core a day. I was only taking 1 of each, and I really, honestly, I wasn't great at it. I was doing it as often as I could, but I wasn't diligent. So I went away to Florida March 24th, and I came back and I took 2 Sol and 2 Core daily. And then in May, I got a phone call that said, I don't know what you're doing, but whatever you're doing, keep doing it. Your tumor has shrunk so significantly that tomorrow morning we do not need to do surgery. And I'm like, I'm sorry, wait a minute. I have 5 pages here of how to handle the kids. I've flown my husband home from China. I have my sister flying from Beijing. My parents have flown up from Florida. I'm ready. And he's like, no, we don't need to do surgery. It's shrunk. And I said, well, how much? And he said, well, let's go find out in June. So June 23rd we went, and it has shrunk so significantly it's gone, and it's still gone. And we had another MRI in January. And all I did was prayers and positivity. I drank extra red wine because they told me I wasn't going to be able to taste. I ate extra steaks, and I'm a red meatitarian, so I ate extra steaks and prime rib, and I doubled up on my Core and Sol. And that's the only thing I changed. So I have gone on, that was in June. In July 15th, I went down to the Gold Flying with Janet, was able to present in front of all of the top executives here with RAIN, as well as the top sales teams. I lost my YouTube channel to the Taiwanese group because they took over my YouTube channel. But basically, I've been able to share it. We've helped a lot of people. We have over 1,700 people on board with us since July. So I did decide to start building it. And I couldn't have done that without the help of Janet and her teams and out east and across Canada and the US. But together, we have put in a lot of people and helped a lot of people with cancer, with MS, Parkinson's, fibromyalgia, irritable bowel, you name it. And I've got somebody in the room here who's filming. And I hate to interrupt her filming, but she's got an amazing testimonial. She's become a dear friend, and I'd love you to hear